Welcome back to another episode of the DNA of Things. Today, we're embarking on an enthralling journey with my friend Guy Leitersdorf, the mastermind behind Longevity AI. Now, in this episode, we are going to delve into Guy's personal saga that steered him toward the nexus of longevity and health technology. Big data science background. We'll explore how Guy brings his insights to Longevity AI's unique approach, using artificial intelligence to forge the path of precision care, offering bespoke health solutions. Join us as we uncover the synergy between AI and longevity and how it's shaping the future of healthcare for individuals and athletes alike. Discover the steps to extend your health span and the insights for entrepreneurs in the health tech landscape. Tune in for a riveting conversation on the cutting edge of health and innovation. Let's dive in. Thrilled to welcome you, Guy Leitersdorf, the visionary behind Longevity AI, and great to have you on the show. You're the pioneer.
Pleasure to be here.
You're the pioneer in leveraging artificial intelligence to explore the frontiers of longevity and health tech. I've experienced the product firsthand. I'm really interested in, obviously, the technology, but obviously the man behind the mission, your remarkable journey in the tech industry, how you got to leading and founding Longevity AI, and really looking to understand how you plan to showcase your commitment to enhancing human lifespan through these innovative solutions. So as I say, welcome. Welcome. It's great to have you, Guy.
Thank you. Excited to be here.
Yeah. And so just for the benefit of our users, where are you beaming in from today?
From Tel Aviv, my hometown.
We're in Tel Aviv. Wow. I actually have a friend from Tel Aviv who I did my postdoc with when I was at Cornell, Omri Karen. He's actually some microbiome initiatives in, I'm not sure which institution, but one of the academic institutions there in Tel Aviv. Really smart individual.
Cool. Yeah. Important frontier in longevity.
Yeah. Well, you know what? We worked in Ruth Lay's lab, who was extending some of the work pioneered by Jeffrey Gordon on the gut microbiome, as I said. But before that, Omri, he worked with Eugene Rosenberg, who did some of the early pioneering work on the coral microbiome. So it's like microbes are everywhere. I'm sure there's maybe even room for that in our discussion around longevity today. But so many questions for you. But as I alluded to in previous conversations, as much as I love to talk about the technology, I love to talk about the human element behind it. So I'm really interested as a starting point. If you could tell me your personal journey that led you to focusing on longevity, health technology, and if there are any key moments that kind of push you into that direction.
Yeah. So I think that in the company we're a group of really great people, and each of us has their own unique moment in life that they were like, okay, this goal is important, and I'm willing to dedicate a big chunk of my effort and passion to it. For me specifically, even when I was young, I found a passion in medicine. I used to volunteer in the ambulance services in Tel Aviv, and I figured out two things. A, there's a lot of emergency medical cases that could have been prevented. And B, that preventing them might be the best way to help people to generate maximum healthy years, basically. I'm a very mathematical oriented guy, so I was trying to think of how to optimize the function. So it occurred to me that getting to that emergency case and only treating then might not be the most effective way. That moment when I decided to shift my career was later in life. I was 3 years ago in this cushy job doing some great AI that I really loved and was very happy with. But my father, who was monitored in the best executive healthcare services and with the best physicians and experts, was diagnosed with a late stage lung cancer. And in the beginning, I was angry and surprised. But eventually I realized what we all probably in this forum that are more oriented towards medicine and longevity know, that it really depends on which experts and which tests were done. And some things cannot be predicted from some basic testing. Some things could. And together with some friends, we just set on the journey of how can we extend health span? How can we give people more healthy years? We discovered it's slightly more difficult than we originally thought, but basically it's about predicting and preventing the aging diseases, as we figured out.
Yeah. So you got right to one of the questions that I want to, or I think you're scratching the surface of one of the questions that I want to ask you a little bit later, which is how do you define longevity? But before we get to that, tell me a little bit about your pragmatic background, like mathematics, AI. What was going on in that previous chapter of Guy's life?
Yeah, sure. So I'm a nerd. So since I was young, I loved math and physics, and that's what I studied in high school and in university. And I was in this lead program in the army that was supposed to train the next technological leaders in the IDF. And I was really lucky to be deployed in a place where I could really leverage the my passion and deliver on some good data science. Before they called it AI, it was just data science. And a little bit fast forward, my previous position is something that I really like doing. I was fortunate enough to join a company called ironSource, really in the leading of the advertising tech like Google, Facebook, ironSource. And I was leading their AI, the product development there. And it's all about those micro engagements, and advertising tech is basically understanding what you would like to see right now, what you would like to do right now, and just give it to you. So it can be, oh, you've just lingered an extra second on this post, on this piece of information, this you started, but then you pause it, this you used to do every Tuesday in the evening. But eventually, I think that it's way more interesting instead of converting into another game or converting to a specific vacation. I think the ultimate currency that we could give people and optimize for is happy, healthy years. And this is the goal that I've shifted my focus from behavioral algorithms for converting something to converting people to having more healthiest, to small adaptations in lifestyle, being the co-pilot of the physician that people meet, to find that really synergy, that real synergy between what can be really great for people to do that they would love to do, but also has great medical efficacy, and the doctor could prescribe them.
That's amazing, right? Because you think about, well, I think there's certainly a lot of negativity pointed at social media in terms of, well, all the things that you just said, like micro engagements and kind of gradually shifting you towards a behavior that may not be good for you in the long run, although it may satisfy, they instantly gratify you, which we know instant gratification is very seldom the thing that's good for us long term. So it's really interesting to see technologies like yours that are starting to kind of turn that on its head. And because you're again, we're into this expert space of longevity. And when I think about human health, wellness, longevity, I think about, well, there's your innate, genetic presets, let's say. There's your environment, right? So where you find yourself, can heavily influence and even potentially override, right? But then there's the part that's in your control, and that's that behavioral side. And so what's really interesting is when you talk about big data, now AI marketing, it's like this thing that was within our control is kind of not in your control, because again, there are these kind of micro movements that you're just unconscious of, time on site, product. And so it's really, really profound to call that into the light and say, no, that's a thing that your subconscious is doing. And there's a huge component of psychology in digital marketing and social media. And so we can take that and we can aim it at the positive health outcome, i.e. in this instance, longevity. And because you're a data guy, it's like, well, no, actually we have some quantifiable metrics, specific outcome, but then also we have these incremental KPIs, let's say, that we can measure if you're getting closer or further away. And so I'm really interested to hear, and I have been through some of these with you. I've seen the platform. I think you have as a top 3 or top 4 area of focus in terms of let's address the big rocks towards longevity and then sharpen the tip of the spear. So maybe you can tell me like a little bit about your philosophy around, hey, why did you choose these particular disease risks, let's say? How is that going so far? And then let's see where that goes. But I assume it'll go somewhere into the realm of how do we live to be 200, like Peter Attia.
Yes.
So let's go to the first things. Like what is going on at Longevity AI, and how are you defining longevity, and how are you helping people achieve it?
Absolutely. So the core of what we do is an AI. Of course, we have a dashboard for medical teams and an app for members, for patients, basically for everyone. But what we're most proud of is our AI. And this brain is really divided into two. One is the medical part, and the second one is the behavioral part. And they communicate together and have a synergy together. So from the medical perspective, we're having great experts in the team, experts in the aging diseases, experts in behavioral science. And they really helped us understand, if you look at CDC data, it will show that 80% of our unhealthy years are really the 5 aging diseases. Diabetes, obesity, heart disease, dementia, cancer. And eventually, they all can be predicted and prevented. We're now running, apparently, I was just recently notified that our research is actually the largest longevity research conducted. We're having 20 years of longitudinal data, 20 years of all of your blood tests, doctor's appointment, medication that you were prescribed, but what did you actually bought? In some cases, some behavioral information like how many steps do you do a day, what are your sleep patterns? And all in all, it's 1.6 million people. We're doing it in a collaboration we really greatly appreciate with 2 big health networks in Israel. And we see the patterns. We see what does it look like when you're having an aging heart, aging cognition, aging metabolic system, all correlating to these 5 aging conditions. So you can see the patterns. You can see it in data that is available on almost all of us in our electronic medical record. And you can see it on that subset of population that are getting more tests where you can get even more in-depth and more predictability. The question is, okay, we can predict, we can potentially prevent if we influence specific biomarkers. And the system can tell you, oh, blood pressure is more important than glucose for this specific individual, assuming you want to give maximum health years. But that's just theory, right? That's not enough. If I tell you, someone on the street, you should improve that biomarker, that's not interesting. It's true that you could improve 100 biomarkers. You could improve many things. But okay, you help me focus on the top 2, 3. That's not interesting unless I can really help you to improve those. And that really differs from person to person. That's really the other half of the algorithm. What are you actually likely to do? Because if you're really trying hard to improve your longevity for a full month, unfortunately, that's not going to create a big impact on how many health years you're going to have in total. Even if it's really optimizing the diet, optimizing the sports, it's a great start. It's a great predictive value for what you probably could do in the future and deliver longevity for yourself, but that's not enough. The real question is, out of all the 1,000 or 100 top habits for you that we can all, ChatGPT, Google, TikTok, whatever, what are the things that are in a good combination of what you will actually likely to succeed in gaining as a habit and delivering a lot of medical value for you? And here, data is our friend. So if you want to truly personalize it for you, then we can connect to your Apple Health, Google Health wearable, and we can know, okay, for you specifically, you need more cardio, but you never ran, you did swim. How about recommend swimming first and not lose you on our first suggestion? If you used to walk 6,000 steps a day instead of 2, we can help you cut your risk for cardiovascular by half and feeling better next week. But it's just more likely to happen if you actually did that until a month ago. So our algorithm is really taking the expected health years, the potential healthy years from the medical algorithm, and the actual chance for it succeeding according to 1,000 people just like you, medically and behaviorally. And then we know the expected value. We can potentially deliver 2 health years for 1,000 people like you. And it's really up to you and your physician to deliver that best plan.
Yeah. I really want to highlight something that you just said, because I think it's a very profound paradigm shifting statement as it relates to precision care. You have a data set, and then you can slice this set in any number of ways. All right. And particular, like how you would slice the data set for me as a user, for you as a user, for my wife, my daughter as a user, that's going to be very, very different. Right. And so I think what you're saying is, in the moment, there's one particular health intervention for you. The irony, or paradoxically, actually, it's like, well, it's for you, but the reason that we know statistically that this is better for you than, say, the average treatment is because we've got as many people as possible in the world like you, surrounded by you, who have actually done this. So it's like you have this clinical study control in real time, assuming everybody is subject to every single possible outcome. But the big data, the more tracking, the more that happens, the more likely that you're going to have that enriched data set. So is that, I just want to emphasize, is that what you meant when you said similar to you medically and behaviorally?
Yeah, exactly. So we're taking evidence-based medicine biomarkers. So we know what evidence-based medicine has to offer for projecting risk for the heart. And we know what behaviors can really impact it. And we have evidence for example steps. And it does matter. Like you said, what's your gender? What's your age? What's your ethnicity? What's your country? Where do you live within your country? More pollution, more parks. How's your blood pressure doing? Was your blood pressure responsive to medication? All this information really sets you apart from other people. And assuming there's enough data, meaning statistically significant conclusion, then we can really deliver that value for you. And that's what the system does.
So you have already, I think you said 20 years of trailing longitudinal data, over 1 million people through your collaborator. And now you've taken this algorithm that you're training based on these data from let's say the scientific community, and now you're going into the clinics and into practitioners. Who are the type of practitioners that you're seeing now that are like the early adopters of your software, and what kind of patients do they serve? Because correct me if I'm wrong, this software is for practitioners and clinicians. Is that right?
Yes, correct. So our software is a health dashboard for practitioners, for health teams, and also a mobile app for their patients, for members. So the really is our two products on top of the algorithm. And it's interesting because we're seeing three distinct businesses that are now very interested in what we do and want to collaborate. The first one, and it's also our first client that we're very happy with, is a private health clinic that is doing that is general practitioners. So people come in, they get their health advice, and but they really want to go to the next level. They want to go to the next level of what data they're collecting, what data they're using, what the level of advice is, not only next prescribed test or medication, but also next prescribed lifestyle habit. And usually we see interesting physicians that are already very forward thinkers, that for a while have been thinking of more biomarkers that would like to collect and more interventions that would like to prescribe, but have yet to find that operation system to help them do it in a very efficient way, with a very informative way, both themselves and the patient, with evidence-based medicine. So really transitioning a general practitioner that is a forward thinker to that precision health, precision executive health, longevity clinic level. The second type of clientele are longevity clinics that already made that transformation, but they're now using many different solutions, sometimes contradicting, sometimes or microbiome results are contradicting the advice that could come from a blood lab, that contradict from type that can do from a lab exercise test in the labs, stress test. And the idea is that, well, for that individual, you really want to do that merge. You really want to understand that maybe it's really important information from their genetics, but combined with their blood, there's another aha moment that you can really think of. And it really saves them the labor and the potential contradictions. The third clientele, interestingly, is the way to achieve the biggest impact, in my opinion, which is public health networks. It's the two partners that we have in Israel and some more in North America that we're now engaging with. They are telling us, listen, we want you to start with executive healthcare, But really, your annual visit with the GP, that's the moment. That's
Yeah.
the moment that people want to learn more about how they can do better for themselves. Physicians are already oriented to help, but there's so little time. So the system that can really cut to the chase is really what they need. So I'm most excited about that moment that we can really deliver it in the public healthcare systems in North America to start, in Israel moving forward, more
Right.
places.
Right. That's amazing. And I'll hear your three markets and I'll raise you two. I think just from and this is like totally, I need to be upfront and share my personal bias. So take it with a grain of salt. So first I think is let's say athletes. And I know this from direct experience. So actually direct and indirect experience. So direct experience as an athlete myself, and I was a sprinter, like again, 60-meter, 100-meter, zero margin of error, zero room for margin of error, right? Because you know it's first place and not even making the final is literally hundreds of seconds. And actually having worked with a cohort of tens of thousands of athletes, we learned that the same problem that clinicians have is the same problem that coaches have, and that is scaling precision recommendations for athletes based on who those athletes are most uniquely like, right? Like as you said at the top.
Yes, indeed.
Right. I mean, something as seemingly identical, homogeneous as sprinting the 100 meters can be done in entirely different ways. You have athletes that, they like to squat 500 pounds and they blast out of the blocks and they have a really strong drive phase first half of the race. You have other athletes, they get injured when they lift anything above body weight. They're more reflexive, plyometric. They're more like gazelles and they have a real fast second half. So that you can actually, you can see anatomically, physiologically, you can measure these aspects genetically. And then also you start to plug in, different subjective reporting, digital trackers, et cetera. And then you can start to see, because the training, what it has built into it is these periodization phases, right? And so typically in track and field, you have, let's just say a long-term goal plan. Let's say it's on a 4-year Olympic cycle, and then that's broken down into a year, and you've got this, kind of macro cycle that you want to achieve in that year. But that's broken down into mesocycles, and those mesocycles are broken down into microcycles, and microcycles typically go over 3 weeks, where you load, then you load, you introduce a new thing, and then you load on top of it, and then you unload and you allow for adaptation and take a break, and you do like three or four of those in a mesocycle, and depending on the athlete, genetically, health records, predispositions, they'll start to break down at certain points, because the name of the game in high performance sport is avoid injury at all costs, find the minimum effective dose, because the non-renewable commodity
always a good idea.
Right. And then avoid burnout, with the called nutrition and metabolism interventions. And I ran the math and there may as well be an infinite number of permutations per athlete. So the recipe, there are some things that are consistent, but the finishing touches. Anyway, so that's one audience. And then I think the other one that I think is interesting and probably the best way, like, so if the success of your company is, happy health and, quantifiably so, let's just say years of enhanced health span, I think you might agree that the younger we start, the more likely you are to achieve that. So
absolutely.
So parents,
aging is damage accumulated and diseases happening in the background. So the earlier we start to treat ourselves better, the better it is.
Well, but so, and you're probably aware of this statistic where it's like if people are prescribed, I think, like life-saving prescriptions, I think the completion of the efficacy of the drug is like it's abominably low, like 20% efficacy, at least for life-saving drugs. In terms of people giving their cat prescription medicine for an allergy, the efficacy is like 80-90%. So
yes.
So what I'm suggesting is, wouldn't parents, and again, this is now me being biased with a 5-month-old daughter, it's like, yes, everything to ensure her long-term health and health span. So anyway, those are just ideas that have come to me just, let's just say, with the spirit, as I said it would come. And I know a lot of listeners are of the human performance interest, and I know that there are actually a lot of athletes listening with offspring. So like, who knows, you may get some people banging on your door to bring your technology institutions, like Olympic committees, for example, could be a really interesting target. So
I agree.
Yeah. Sorry. Tell me your thoughts on that. And
my 2 cents on the matter is I used to be a professional athlete, and I used to really admire the way that my trainer could really help me fine-tune my performance, both from a physical perspective and a mental perspective, right? Being a professional athlete is also a mental game and a mental challenge.
Right.
And I think that if we can quantify those metrics, if we can have both trainers, committees, athletes, the opportunity to have more data-driven information, data-driven results, guidelines, plans that can adapt in real time, then it's really that aha moment that we can create that synergy. Of course, athletes have different metrics, but yeah.
Similar math, right? Similar biology anyway, biology and math. Well, you know what I was going to say is that, it's that confluence of like high tech, high touch, right? You were talking about coaches and, I don't want to belabor the athlete thing, but, I kind of look at what you're doing is, okay, maybe we're not training athletes, but maybe we're training like healthletes. You know what I mean? People who are as serious their health as athletes are about winning, let's say.
Exactly.
Wouldn't that be an interesting shift? Yeah. So, on your point about, okay, how do you pair the coaching and then take the coaching actually as a future AI based on how well that recommendation returns the outcome predicted, let's say, makes for a more humanized experience, I guess, with AI. And I'll give you an example. So I do coaching with entrepreneurs, right? And there are some things that, life events that entrepreneurs are challenged with, frankly, that we're all challenged with, right? That can really derail us. So, like just crazy, let's say capital raise or getting products across the line, or team sprints where you're just kind of like head down and, it's like, oh man, like I forgot to take, my meditation break, or, I have a glass of wine with my team and oh, does that derail like my health? And it's like, no, man, like, let's not forget about the importance of the social element of longevity. It's like, hey, if you need to have a glass of wine, just followed up with some electrolytes, water. So every glass of wine, drink a liter of water with some, lemon juice and salt, right? And so because health is it's personal, right? Like it's really, the risk I find, I mean, this is me personally, is maybe I would tyrannize myself too much. Like I think about being an athlete, like being too regimented, but I don't think that that's a problem with this interface. I mean, I'm really excited to understand. So I understand how this makes things better for the clinician, but to understand the day-to-day experience from the consumer, where it's like literally somebody has your back. It's like Iron Man who has Jarvis and is like, hey man, like don't go too high because your suit's gonna ice up and you're not gonna be able to fly. So like I'm interested to know, it may be too early to say, I don't know, but like what's the end user engagement like? So let's say yes from a data perspective, but then also like what are people saying?
So, speaking of being a founder myself, it's not really always correlates well with longevity, right? The long hours, that objectively stressful, exciting, but stressful moment that you're having when you're launching a new product. So I think that all people, but also founders, can really gain from this balance. And what I try to remind myself, and I'm trying not to be too strict with myself, is, for example, one of the most not useful habits is smoking, right? It's like everywhere the evidence is very strong and it's for every practically aging condition. But it's still not as dangerous as being lonely, for example.
Right.
So that social aspect, that mind aspect is also very important. People who are happy live longer, happier life, but also really you can see it in the data, they live disease-free for longer. People who have somebody to care for them are people with better social, subjectively social enrichment. So I think that the balance is key. Being too strict is not going to get better results. You really need to find your balance. And to find the balance might be more difficult to define than a specific extreme, as good as it
Yeah.
could be. From the perspective of the user, founder or not founder, I think that we're actually launched with our dashboard for the physician. That's where we are right now, and we're going to launch our app very soon. We're very excited about that. So I cannot give yet an understanding of how that will look like, but I know from my experience that it's really all about if people feel that you get them, that people should expect from medical solutions, from lifestyle solutions, from their doctors, the level of personalization that they expect from YouTube, from Netflix, right? When the next recommendation doesn't really follow suit with what you expect, you're disappointed. You want something that really is tailored to what you want to see right now. I think this is something that we should expect from our lifestyle solution, from the engagement we have with our docs, and then they're prescribing our lifestyle. So this is what we're going for. We're applying these algorithms. So we're taking medical standards, we're taking proven interventions to delay the onset of the major aging conditions. And all that we're doing is tailoring to what you feel like doing right now. So that's how the experience is going to feel like. I hope that's what we're going for. But we can talk again in a few months and I can give you some stats.
Yeah. Okay. Well, that absolutely want to hear how that is going, because I think you're right. It's key. Like the feeling that you're a part of something. Not to belabor the smoking point, but what you said made me think of something. When I was really young, I saw my dad went to, he was visiting like an old friend, and then so when he went and visited them, his friend went out and had a cigarette because smoking is not good around the children and secondhand smoke, etc. And then when I went outside, I saw my dad was smoking with him. And I said, "You don't smoke." And I was like, "No, I don't." But it made him feel more comfortable, right? And he was dealing with, his friend was dealing with, the passing of his wife, let's say, right? So yeah, I mean, obviously we're not suggesting, this is this is a podcast where the topic is about longevity, and somehow we're talking about the longevity. That's not what we're saying, but
yeah, it's probably not the best idea to smoke, but being social is important, regardless of anything else.
Well, and that would be a really interesting thing to see is, does this app make me more social, and not social on social media, social in the healthy ways, in the ways that add decades to your life. Really, really excited to see, where those data lie in the. So you have a bunch of early adopters. Like what projects are you most excited about?
Yeah, I'm actually most excited about two things. One, that after the very long, hard work that our experts and amazing team have done to see it really unfold and deliver more healthy years according to the best medical standards, there's a way to assess the risk. Of course, we build on top of the medical standards and deliver more biomarkers and better predictability, but taking those medical standards of the risk and how many healthy years have we given, this is the most exciting for me. Like, I want to give 10 billion healthy years to humanity. And that's a big ask for myself and for my team, but that's where we're going. So I'm excited for year number 1, which is coming very soon now that we've launched. And the second thing that I'm very excited is to see how not only we do that kickstart, is how we scale. Because anything I do, I like to think that I've done this technological development or the scientific development once, but now many people can enjoy it. So I think that my next level that is like the aha moment for me is that I know that we've started broadly servicing the public from the public systems perspective, and that healthy counter is gonna work extra.
Yeah, that's really interesting. So what is your like business development and sales process like? I mean, like you talk about the journey of an entrepreneur. There's that first stage of product ideation, but getting to the aha moment where you get to your ideal customer. It sounds like you've got 3 markets. We talked about an additional potential 2, but so how do you go from innovating this amazing product that, frankly, very few people are going to understand and be able to access without the whole ecosystem, right? Without the clinicians, without, say, public health policy behind it, and without having the device. So what's the step from, scaling responsibly so that you can get to these 10 billion health years? What's that like as an entrepreneur?
Yeah. So what we've been actually, the feedback that we got is that our system is not only the only one that can help them reduce the workload of physician to avoid conflicts of all these different testing, and not only save doctors time with assessing different risks and understanding how can I best help the patient in front of me. It was just a simple feedback that we got that it's really flexible to what this clinic specifically needs. And that is the key to really scale within our organization. So the process that we're having is, okay, we're showing you the medical standards. We're showing you, okay, the medical standard for evaluating the heart. Quick story, I think people should, I was really surprised when I first learned it. So if I want to assess the risk for the heart, it's the Framingham score, done 50 years ago in a small population in the US, in one village, not ethnically diverse, 50% smokers, very little diabetes or hypertension. Comparing to today, that's what we would call biased data. And it's really the best way to assess the heart health of everybody that's listening right now, according to the health professionals that are servicing them and what is learned in medical school. But also all physicians would agree, hey, maybe diabetes, yes or no, maybe can be better assessed as glucose or A1C, right? We're living in 2024. So really taking those medical standards and leveraging above them is the opportunity. But the feedback that we got is that we're very flexible in the sense of, okay, we have A1C, we want to deliver your app so we can get the steps and sleep and any other sports patterns that this person might have, or mindfulness patterns, and maybe high sensitivity therapy. But some other clinics will not want to use that last metric because it's more expensive and maybe doesn't fit that specific clientele or that specific testing or that specific set of experts that they have in that clinic. So the challenge to providing longevity and scale is the challenge to delivering strictly evidence-based medicine, but the level of depth of testing could be flexible. And the fact that we can do it, to your question, how do we onboard a new clinic? Hello, we're Longevity AI. Please enjoy the demo. They onboard they download a sample data set. They see that they like it. And the way from there to tailor it to exactly their needs is a 1-hour session with our team. And within a week, they get the keys to their system. So you can onboard as many clinics as you like. If you're a health network of 1,000 clinics, you can do it super fast.
Yeah.
So I think that the onboarding is really all about having it tailored, but in a quick, efficient way for the clinic team.
Yeah. Really interesting. Well, I hear you speak, and, speaking to many of my guests, like thinking about these future health trends, the future trends in health services, let's say. So clearly technology is an integral part. Like actually we're seeing a lot with mental health as well, PTSD.
Absolutely.
Yeah. And so it seems to me that there is a certain level of practitioner education. So given that the technology, like the high tech, high touch confluence is inevitable, maybe that's the singularity that we should be embracing, right? AI, let's say. So I think about the barrier to a clinician adopting a new software. It's like I come out, barely out of med school, I've got all my debts, I've got more patients than I can handle, and your solution will get them there. It's just a matter of, well, when am I going to get time to do that when I've got all these other things going?
True.
But to me, it does seem to be an inevitability. And so like, it sounds to me like you've reduced the training time to an hour. That's awesome. I'm sure, well, from what I've seen, the UI is very intuitive. I've seen the dashboard, like I get it. It makes patient visits faster. There's all kinds of times. There's probably like, let's not forget about the longevity that you've added to the healthcare. And then that's a force multiplying longevity that they're giving. So that's really interesting. But have you thought about, professional schools? because like what you just described in terms of like this
Mm-hmm.
standard biased trigger for, or sorry, standard for heart health, it's like, how do we get into medical schools and, deploy this as well, at least maybe like a guest lecture, but then how does it become a part of the curriculum? How does it come kind of like
Mm-hmm.
how does part of the clinician's core competencies become, here's the best technical suite to use, or is that too
Mm-hmm.
much? So it remains separate. Like, have you thought about that when you think about how your company scales?
It's a great question. I personally really believe in education, and I find it really rewarding. So I teach the MBA at Tel Aviv University, and I was a guest lecturer at the MBA of Cornell Tech while I was living for a while in New York. And I think that the MBA is an opportunity for physicians who want to take it to the next level and are, some physicians are really excited about emergency care. And I think that's wonderful. We need those.
Yeah.
I experienced that. That's nothing more comforting than a real expert treating you when you really need it. Something was broken, I need it fixed now.
Yeah.
But I think there's another area of medicine in which proactive care is the best way, especially for your annual visits with your GP or whenever you have a spare moment for your health. So I think that for that area, some physicians feel that it's most appropriate when they do their MBA, when they want to explore their own path, where they want to expand their horizon. But from your question, it really gets me thinking, maybe there is a way to get those physicians who come to me for the masters and really maybe open or suggest potential course in medical school, because I think the challenge of longevity, or one of the challenges in longevity, is really explore that evidence-based medicine box, which is really rich and has a lot of potential, and delivering that exactly as the physician would expect to get it.
Yeah.
And maybe that's a goal for the future. But right now,
Yeah.
I see that as a second step, they're very excited to see it.
That's a really important differentiation. Thank you for bringing it up. Like, we often criticize sick care and reactive medicine. It's like sometimes that's exactly what you need. If you break a femur, that's a potentially life-ending injury, and you need somebody who can do that. Could you have avoided the injury? Well, maybe not. It's a car accident. Like, there's a lot of bad luck out there, right? And so we do need great physicians. But on something that you had said in the beginning, it is, well, if those physicians are dealing with so many emergencies, and let's say 80% of those emergencies could be prevented, then 20% that can't be prevented are they're grouped in the whole thing. And so health overall goes down. And, I see this like being in Canada, we've been positioned as, oh, well, it's great. We have, taxpayer healthcare. It's like, well, it's about an 8 to 12 hour wait in the waiting rooms. So, that's not ideal. That's really not ideal. And, the healthcare workers are stressed and taxed, and taxpayer dollars aren't, well, the health outcomes aren't there. So I do see, 10 years of application of your solution is, well, you would see like an indirect effect on, let's say, reduced waiting room times because there's less emergencies. So that's a really interesting way to quantify all these different ways of quantifying the value. Okay. Interested to know so how long have you been with longevity? How long has it been?
Officially 2.5 years, but
Okay.
I've been starting to think about it a little bit before. It was
Yeah.
very abstract in my mind in the beginning. How could you possibly approach this? And we approached this from the perspective of nutrition and sports and mindfulness and sleep, and from the perspective of genetics, epigenetics, blood works, and we really wanted to see the big picture. And really, as AI people, that's what AI knows how to do best. Like, we give a lot of information, and if you structure it correctly, you can get the great conclusions. So a big chunk of the time, like 6 months, was just the architecture of how do we want to define the data sets, and what do we want the algorithm to do, and how do we make sure that it's completely evidence-based medicine. The results are fully explainable, not a black box like we see a lot in AI today. It just wouldn't fly. Not with patients, not with medicine, and not with ourselves. We want to have the proof, clinical proof, that we're using in our model. So 3 years only though, 2.5 plus 6 months of thinking about it.
Okay. So, I mean, I don't know what version of yourself you would consider yourself to be, but let's just say before Longevity AI, you're Guy 1.0, and now you're Guy 2.0. How has your worldview changed, if it has at all?
I'll share with you what my colleagues, my team members shared with me. They said, "Guy, I hate you. I used to have a great fun eating all these burgers and all the chips and being slightly lazy." They're actually sportive. Like I swim. A big part of the team is my swim mates, and others are people I run with, etc. All these like-minded people, but we all have our habits that we're not exactly highly correlative with longevity, and that's okay.
Mhm.
And but they shared with me that now they're more mindful of the evidence, and it, on the one hand, it really helped them gain healthier habits. On the other hand, you're missing something you really love it, but the idea is the balance, right? So I feel the
Mhm.
same about myself. I still have my good habits. I still have the habits that are probably more good for my mental health and my physical health, but I
Mhm.
feel that at least I'm informed, I'm mindful of it, and from my perspective, I have a balance I want to have, which I think
Mhm.
if you grant that power to the individual, maybe that's the best gift we can give. It's not just a piece of information or that push in the right moment. It's
Yeah.
really the empowerment to have the balance they want to have. There's a cost. you're
Mhm.
you're having slightly less maybe shakes or burgers, but it might be a good thing.
Right. Interesting. Yeah. So, well, I mean, it really comes back to one of the things that you said at the top of the call, which is, you're in your previous life on the, data science and the marketing, kind of edging people towards the purchases of, things they habitually do, which may or may not be good. You're like, no, there is some, I think what I'm hearing you say is I've changed the kinds of habits that I do daily. And then that
Mhm.
is the thing that's adding, well, because you want to add your decades to your life as well, right? Like you want to be an exemplar of the product. Yeah.
And for the people I love, yes, that's my goal. I really hope also to work and establish an activity in Israel and New York, and now with new friends that I have in Canada.
Yeah.
Uh, on top of the fact I really want to be scalable and deliver many healthy years. We're all people, and I also personally care in seeing the people I love getting the best access to what can gain them more healthy years.
Yeah. Yeah. Well, you've made the transition from one career to another, seemingly at odds with each other,
Mhm.
but seem to have done it gracefully. You're giving back on the education side of things. What advice would you offer, those listening, whether they be, entrepreneurs in general? Let's say, two types of question. Let's say two questions. So number
Mhm.
one, what advice could you give entrepreneurs in
Mhm.
terms of, well, from your learnings in so far as making a leap into, like I say, seemingly across disciplines that may seem uh, at odds, but clearly not. And then the second thing is, what is the best thing short of using your app can people do now to add, let's say, 10 years to their life? And let's get 1 million people
Mhm.
listening to this so I can add 10 million to your 10 billion.
All
Let's say.
right.
Yeah. Yeah.
All right. Okay. Cool questions. So my 2 cents for entrepreneurs or anybody who want to come in this exciting field is, number one, follow the evidence. I think
Mm.
there's so much potential with the evidence we have today and the evidence that's coming in every day. Our algorithm is like scraping the web every day, bringing new evidence-based medicine to the table. So looking for that can really push you forward in a way that is quantifiable and trusted. I think the second piece of advice that I would give is, eventually try to look for the synergies. There's a lot of great new data, a lot of great evidence, a lot of great new interventions, some more novel, some more classic. I would look for the synergies. I would look for the combination of a new test with an existing intervention, or a new intervention with an existing test, and try to find that moment that you take two, 1 + 1 = 3. I think that's the entrepreneurial element that can come into effect, that it's not only that technological or scientific development, it's that opportunity to deliver new value that you and your team create. I think maybe the third piece of advice is to have a great team, a well-rounded team. So when you're doing longevity, it's important to have an emphasis on science, technology, and of course, business development. You really want to deliver value in all aspects and deliver novelty in all aspects. And I think that longevity entrepreneurs don't have the privilege of just going for one. I think that also you have an amazing platform, and I'm excited for our collaboration. And I think that this is another example of, in order to succeed in longevity, you really need to have that expertise, and having a great team with you is what it really takes. Yeah, so that's about my 2 cents for people joining the field, and hit me up, right? If there's something exciting, let us know. We're happy to collaborate. And the second question was?
I think you, well, the second question was, how do you ensure
10 years? Okay.
How can I add 10 years to my life and make it? Yeah.
So I can think what I would do for myself, for myself and for my loved ones. I'm really starting with what people love doing, but not necessarily doing right now. They need that extra push, that extra social element, that extra visit at the doctor to have that commitment going on, and then to match it with that right evidence, because you don't want to put your focus on something that has no evidence, or something which is not really the needle mover for you. Maybe adding 5,000 more steps is great, but you really could have gained much more than reducing one soda a day. It really depends on your current health status, and it really depends on what you think you're willing to do. So looking at one evidence and going all in, or looking at something that you like to do and going all in, is great. It's really any step towards your health is a good one. But my advice to getting these 10 years is looking at that combination. And if we're looking from an algorithmic point of view, what our system does is takes all these aging conditions, understanding in which system you're aging the fastest. Is it your heart that's aging the fastest, or cognition, or metabolism? And that's where we focus on the system that's aging the fastest and is most likely to reduce your health span. Once we have this in focus, we find those biomarkers that are really crucial for the success, because some biomarkers are going to do great for that aging system, right? Maybe for the heart. And then we connect it to what you love best. So what our algorithm does is it automatically takes thousands of research papers, experts' opinion, and really digest it in a way that you're very likely to love. So the best thing you can do for your longevity is enjoy the new science and technology coming up. We're happy to be one of the services for you, and do that combination of evidence and passion.
Love it. Guy, how do people find you? I know the website's longevity-ai.com, but where do they find you on social or elsewhere? How's the best way to get in touch?
We have Instagram. I'm active on LinkedIn. I see that many people just approach us on the website. Many of the best collaborations and individuals that are now our beta testers come from the website. But basically, any way that's convenient for you, just approach us, and we're happy to collaborate.
Awesome. Guy Leitersdorf, thank you so much for giving us a window into your universe at longevity-ai, and really excited to have you back on and hear how many billions we are towards those health years that you're looking to give back to humanity.
Absolutely.
You're doing incredible work. It's been a privilege talking to you. Thank you so much.
Thank you so much for having me. Looking forward. Bye-bye.
All right. Well, that wraps up our discussion with Guy Leitersdorf at Longevity-ai. We've uncovered the pivotal role of early adoption of healthier habits for longevity, the significance of life-saving prescriptions, and the need for personalized lifestyle solution. Balancing health with social well-being emerged as a cornerstone of this optimal longevity perspective. And we dove in and saw how Longevity-ai's mission to deliver evidence-based, personalized health solutions underscores our dialogue of today. The interesting perspective here you might also consider is not to look at yourself as simply as a static, unchanging individual, but rather a community of selves, and how you compare to other communities of similar individuals in order to gauge how you might actually come up with an evidence-based, data-driven precision medicine approach to your longevity. Remember, the journey to extend your health span starts with informed choices and a proactive mindset. Thanks for tuning in, and let's continue to explore the DNA of things that shape our health and the future. Thanks very much.